So before we go into details of medications to be taken during diabetes treatment, we should understand what are incretins. Incretins are intestinal hormones released in response to nutrient ingestion, which potentiate glucose-induced insulin secretion. There are two incretins. One is gastric inhibitory peptide and another is glucose-like peptide 1. Gastric inhibitory peptide, this is 43 amino acid long and it belongs to secretin family hormones. Secretin family hormones you have already heard, they contain secretin, VIP, glucagon and GIP produced by certain K cells of human duodenum and jejunum, and GIP as well as it is gastric inhibitory peptide, so it is inhibiting the gastric emptying when you take high fat diet, as well as it is insulinotropic. That means it causes the release of insulin in presence of glucose, and that is why it can also be called as glucose dependent insulinotropic peptide. It affects oral glucose ingestion more than intravenous administration because it is released from the intestine, so it senses the presence of glucose in the gastrointestinal tract, and it is potent stimulator of pancreatic water and electrolyte secretion. So this is helpful in digestion of fat by inhibiting the gastric emptying, and it is causing the release of insulin to absorb glucose, and as well as it helps in digestion by releasing the water and electrolyte from pancreas. Another incretin is glucagon-like peptide 1. GLP-1 is encoded in the proglucagon gene. This is expressed in intestinal L cells, which are located in distal jejunum and ileum, and it is released after oral ingestion of nutrients, so which is like your glucose, amino acid and fat. Everything induces the release of glucagon like peptide, and it stimulates insulin secretion in presence of glucose, and as well as it enhances the gene of insulin expression, and at the same time it inhibits the glucagon secretion. And these GLP-1 agonists are useful for treatment of NIDDM, which we'll see in the medication section. You can see in this diagram that when you take your food in the intestine, it is releasing the GIP and GLP, which is stimulating pancreas to release more insulin and causing the glucagon to get inhibited. Its secretion is inhibited. Now medicines. Based on this, we can decide what medicines you can take. Metformin, which is required during the, or which is helpful for lowering glucose production in the liver, and it improves the body's sensitivity to insulin so that more insulin can be utilized effectively. And sulfonylurea, another set of medicines which is required or which is useful for helping release more insulin by the pancreas. Thiazolidinediones, these are the drugs which are increasing the sensitivity to insulin. And GLP-1 receptor agonist, these are injections, and they are slowing the digestion and help lower blood glucose level. Sodium glucose transporter inhibitor. So these SGLTs are present in kidney, which is for the absorption of glucose. So if you use inhibitors of these transporter, they will inhibit the absorption of glucose, and glucose will be secreted into the urine. And along with that, it will also cause the release of water by osmolysis. So that way, it will cause the decrease in the blood pressure. So it can help in treatment of hypertension, which is caused by the diabetes. So next option is surgery, which is pancreas transplant in case pancreas is not functioning properly, and kidney transplantation if kidney failure occurs in severe diabetic condition, or weight loss surgery or bariatric surgery, which is to remove the adipose tissue, which help in increasing the insulin sensitivity.